We're here at Palm Valley Pediatric Dentistry.
We were extremely comfortable here.
We see kids from the age of newborns actually until 18.
I was nervous, but they made it really comfortable and I love the dinosaur chair.
We're trying to tailor to every single kid. We have iPads, kids can come in and feel homey.
And it's very kids-friendly.
In this room, we mostly do preventative dentistry. We want to provide the best care to our kids. Sometimes moms have a lot of questions, right?
It feels like family here.
Well, it was beginning of 2000 when I was making big decisions. I didn't know what type of doctor I wanted to be. I was in my undergrad studies studying biology. I definitely liked the science part and I was really good at it. But then decision time, what do you want to do next? As a child, I was in an art school. I used to draw and do glue modeling, and that was something I really enjoyed. It never crossed my mind that dentistry can interconnect. I had a friend who was actually planning to go to dental school. And he's like, Olga, you're so good with your hand. Do you want to come over to dental school and just see what we do? And I actually did that. So I came to dental school to observe. They actually had that option in Louisville. I was in Louisville, Kentucky at that time. When I went to dental school, I was observing clinic and one guy was doing a front tooth on a woman who broke her front tooth. And I was fascinated. I was like, oh my gosh, that looks so bad. The tooth is broken to the gum. There's nothing you can do. It looks awful. And all of a sudden, an hour later, the lady came in with beautiful front tooth. I was like, oh my gosh, this is something of my interest. I really like that. So I started to observe more and more, and I realized that my passion for science and my artistic side come together in one specialty, which is dentistry. Thank you. Good job. That's it. When I started dental school, my son was 3 years old. So I had a kid before my whole educational journey. I was a young mom. I was worried about it. I remember my white coat ceremony graduation, and Christian was sitting and eating crackers. They gave me a white coat and he looked at me, he's like, Mom, you're a doctor now. And that was my first day in dental school. And then the journey of dental school went by quick. I didn't know a lot of things. So Chris, my oldest child, ended up having a lot of cavities. I was like, oh my God, my kid is getting cavities. So we actually took him to a pediatric dentist. It was my first encounter of pediatrics. I was like, oh my God, this guy can fix my kid's teeth. And I still remember Dr. Phillips. He was an older gentleman who sedated Christian. Christian did great, and we just came. He got sedated, got all his teeth fixed, and I didn't have to worry about it. That was it. And I was like, oh my God, that's interesting. That's pediatric dentistry. It became like a little puzzle. I like science. And then in pediatrics, we also have a big medical part. I actually need to know all the syndromes, all these diseases. I need to know oral presentation of all these diseases. So I was thinking, that's really cool. So I'm not just a doctor who drills and fills. I actually can understand the prognosis. I can understand the diagnosis. I might suggest to my current patient, Mom, maybe you should get on that vitamin C or check your vitamin D levels and so on. And that triggered my interest. So I started to observe more in dental school pediatric clinic, and I had one of the most talented professors there. She would pretend that she is a different animal. And all of a sudden, me, her, and the child, our patient, all playing one game. We're sitting down, we're doing extraction on the kid. Kid is cool, we're all doing these noises, and at the end, we're done. I was like, oh my God, it has artistic part of it too. Hello, good morning. Hi, I'm Dr. Olga, nice to meet you. Who do we have here today? What's your name, my dear? Christina, how did you do? In the middle, okay, sounds good. Let's take a look at your pictures first. I'm gonna look at her panoramic X-ray. This is a big X-ray. Looks really cool. Look at those teeth. Oh, wow. All right, let's take a look. I'm gonna put my mask on. I'm gonna put my super cool glasses on. I'm gonna look inside your mouth with my special mirror. Can you bite and smile for me? Good girl. All right, we're all done. Good job, Christina. She will need sealants, a protective coating for her back teeth, okay? We took her panoramic X-ray. She's not missing any teeth, no pathology. Everything looks really good. Keep up good work on brushing and flossing. Bye, Christina. I'll see you next time. It was so nice to meet you. After graduating my residency as a pediatric dentist, I joined one of the big corporate groups. Corporate experience was not the best in terms of not be able to do what I want to do. And I knew I can use better material. For example, I really like suctioning device Isolite. And if you're my patients, you know we're using it because it's a great isolation. Fillings last longer. And they couldn't provide this for me. I was not happy in that place. And my dear husband, who has a business head, he's like, Olga, you keep complaining about the same thing over and over again. You don't like this, you want to do this. Why don't you create your own? And that's how Palm Valley Pediatric Dentistry started. That's how our whole journey began. We created a brand, we call it Palm Valley Pediatric Dentistry. I want to be next to my house, and that's when we opened our first location at Dolghier, Palm Valley Pediatric Dentistry. We opened a second location in Surprise because we noticed that some patients are driving a distance. And then later on, we opened another location in Bacay, Virado. I'm in Virado right now. We built this beautiful building. Since we became bigger, then I started to hire dentists. Next one was Scottsdale, and new office now is in Chandler and Mesa. So we're kind of covering the whole entire valley. We opened our first practice in 2013, and the latest practice was opened just this spring in 2025. So we grew a lot, we learned a lot from our experience, and I don't think it's the end. We want to provide that best care to our kids, and our team, we hire only board-certified doctors, orthodontists, and pediatric dentists by developing our brand, developing this interesting way of thinking about providing care to children. We're trying to establish the same type of practice where priority are children, priority is overall health. It's not a drill and field practice. So all this would never happen without my husband. My husband is a big part of our practice. Adrian was my biggest supporter. He always cheered me up for my ups and downs because a private practice and opening your own business is not an easy task. I would probably never have so many vacations if it would be not my husband, because we all have different hats. So I'm the doctor side and clinical side, he is all business side, team side. So it's a perfect combination because my husband has business managing background, also law school background. So it's a really good synergy between me and him that allowed us create this big brand. Understanding the brand, I'm learning from him a lot because I know dentistry, and a lot of dentists, we're just like focused on just one thing. But business side, I'm not familiar with. So he is definitely a big contributor to success. So fun fact about Palm Valley Pediatric Dentistry and Orthodontics. Now we have 6 locations. We have 9 doctors. We have about 50 family members or our big team. We grew a lot. We started from 1 practice, 1 doctor, 1 assistant, 1 office manager, and now look at us. That's a dream come true, actually. American dream come true.